Kadir Mate, the president and CEO of the Institute for Health Improvement, warned of the premature rush to end the emergency declaration, despite less of a threat from COVID. Mate and others stress that less threat doesn't mean no threat. About 500 people are still dying each day, even in, quote, good times. Before the uptick in cases after the holidays, roughly 300 were dying on typical days. It's been that way for months. People who are elderly, or under vaccinated or immune compromised are the most vulnerable. And really happy that President Mate really spoke up on this. And we know, and I've talked about this before, America, that we have not mourned the deaths of over 1 million people. And that is coming from a bishop who talked about that in one of his sermons. And that is so very true. The fact that we can have millions and millions of our family and friends, sisters and brothers just die from COVID, and we not even pause just for a moment to recognize that death, the tragedy, says a lot about this country. And at the rate we are going, the death toll this year is likely to be well over 100,000, possibly closer to 200,000. And even though you hear all the time that COVID is just like the flu, that's considerably higher than the amount of lives lost to the flu in a typical year. Flu deaths vary a lot from year to year, but only twice in the last century has it exceeded 100,000. Y'all need to go ahead and bold and underline an exclamation point. We need to understand this. Further, it is truly irresponsible and immoral, and this is going in the sin and the shame category, for elected leaders to just arbitrarily end the emergency. Just end it, knowing that the impact of the COVID-19 virus is still rippling through this country and in communities that were already suffering previous to this. The suffering got deep. And instead of them not letting this crisis go to waste, like never let a good crisis go to waste, and do everything that you can to uplift the American people, they are going in the opposite direction. Now, China rushed to exit from its COVID policy during the winter, and results were disastrous. This headline right here, ignoring experts, China's sudden zero COVID exit cost lives. Many older people weren't vaccinated, pharmacies lacked antivirals, and hospitals didn't have adequate supplies or staff, leading to as many as hundreds of thousands of deaths that could have been avoided, according to academic modeling. More than 20 interviews with current and former Chinese Center for Disease Control and Prevention employees, experts and government advisors, and internal reports and directives obtained by the Associated Press. So again, Dan, we have a lot of people with fancy titles being very, very irresponsible.
And not only that, because I know we have a lot more to get to, but we don't even know, this government is not even interested in trying to figure out the ramifications of long COVID. We're still trying to figure that out. We know that even just one exposure to this can make you susceptible to long COVID. Repeated exposures make that even more worse. And when we don't know the symptoms, we don't know how to treat it. And just like many other cases in the American medical system, when you try to get treatment for it, oftentimes the doctors just aren't trying hard enough to help their patients. This is an issue that is very much still an emergency. And just arbitrarily saying that on 12/01 and some day in May, it's no longer an emergency is extremely short-sighted, and it's putting people's lives extremely in danger.
That's right, and it doesn't make it not an emergency just because they said so. And you want to talk about following the science. And sure, we should definitely critique people, especially elected leaders, talking particularly about the GOP, for example, that don't want to believe that climate chaos is real. They don't want to follow the science. We have the same case here where you have elected leaders, particularly Democrats from the 117th Congress in particular, not wanting to follow the science on this. And it just really boggles the mind entirely.